The Affordable Care Act turns 10 years old. It was back on March 23rd of 2010 that President Obama signed the Affordable Care Act into law. The whole purpose was to make healthcare coverage more accessible and affordable for more people across the United States, whether that was purchasing insurance in a new marketplace that was established or through the expansion of Medicaid. Now, 10 years later, more people rate the Affordable Care Act favorably than ever before, and even more people depend on it for quality health care and coverage. Now, there were very popular provisions of the Affordable Care Act that are still popular today, and we are relying on them more than ever before. The prohibition against discriminating against people with pre-existing conditions, covering essential health benefits that we've all agreed on have to be covered: newborn screening, prescription assistance, maternity care. Affordability measures to make sure that we can bring the cost down for consumers that are purchasing insurance for the first time. Medicaid expansion, like we said, anti-discrimination rules, even some enhancements to Medicare through some prescription savings options, rate review and medical loss ratios that help make coverage a little bit more fair, and transparency and review measures. A lot of things happening behind the scenes that make insurance work better. Insurance works best when there are more people in it. You can spread risk, you can bring costs down. Part of the goal of the Affordable Care Act was to do just that, but also realize that health care works better when more people are healthy and you start earlier. If we can have children have a good, healthy start to life, they'll be healthier adults when they grow up. But the Affordable Care Act hasn't been without challenges, most of them in the courts. Legal challenges started right out of the gate. In fact, the U.S. House of Representatives voted itself to repeal the Affordable Care Act over 60 times. Now, the proliferation of short-term or junk insurance plans has also been a threat to some of the quality and comprehensive measures of the Affordable Care Act, pulling people out of marketplaces looking for what they might consider to be a cheaper option. There's also been a reduction in consumer assistance money, especially in recent years coming out of the administration, reducing both navigator assistance, education and outreach money, and the availability of getting local help if you need help signing up for an insurance plan. There's also been shortened windows of enrollment. Open enrollment used to run a lot longer. Now it's a very quick turnaround to try to get as many people as possible signed up for coverage. And there have been more opportunities for states to sidestep some of their Medicaid rules through demonstration waivers. All of these attacks really go after the essence of the Affordable Care Act and the options of expanded coverage. But 10 years later, the Affordable Care Act has shown that it does have staying power. It's hard to take health insurance coverage away from the over 12 million people that have gained it in the last several years. 10 years of data also has been collected that shows the impact of the Affordable Care Act on improved health, on better birth outcomes, on a reduction in health disparities, and even getting more people into the workforce and reducing poverty. And in a time of crisis, improved access to health coverage and care is necessary. We are in a national emergency right now with the coronavirus or COVID-19. We are trying to get as many people enrolled in quality health insurance as possible so they can get the testing, the treatment, and the care they need to stay healthy and not be a risk to those around them. Having things like the Affordable Care Act and Medicaid expansion in place makes that easier. So what's next? Well, it's anyone's guess. The fate of the Affordable Care Act is actually back to the U.S. Supreme Court in its next term. And we have a presidential election coming up in November. Some are calling this election a bellwether for the law's ultimate fate. Congressional Republicans dramatically opposed the Affordable Care Act for many years. And despite it being popular among constituents, we have Democratic candidates arguing for other options, maybe beyond what the Affordable Care Act does in Medicare for All or public options, maybe sidestepping some of the Affordable Care Act protections in their own right and doing something totally different. But the coronavirus or COVID-19 could change minds and could change votes. So as we celebrate the Affordable Care Act's 10-year anniversary, let's now have a renewed pledge to make sure that we can make sure our friends, our neighbors, our loved ones are connected to quality health insurance and coverage that they need to stay healthy, to stay productive, and to stay happy.